And I think what we will do is to try to cover some of the aspects of infection prevention. I don't have a conflict of interest related to this particular talk. So my great mentor and my boss, Dr. Rothman, said that when you hand a diagnosis of infection to a patient, you ruin their lives. And it's equivalent to giving them a diagnosis of cancer. 40 years on, that statement is still true. Unfortunately, infection has been on the rise, and infection related to implants, particularly periprosthetic infection, is challenging. It leads to severe morbidity for the patient and mortality for the patient. If you look at the 5-year survivorship of periprosthetic joint infection, it's pretty similar to some of the common cancers. And there are, in fact, parallels between cancer and infection, which we are discovering more and more of. One of the issues is that some of these patients even die between the first and the second stage. This is Keith Barron's study, and we also had similar studies. And of course, some of our patients lose their limbs. So the future has to be different. What we've been doing doesn't seem to work. We've got to think outside the box. And some of the young men and women in this room, this is on your shoulders now to be able to move this field forward. Fortunately, there is more and more attention being paid to infection. As you can see, the number of publications and work related to infection has been on an exponential rise. Despite all the efforts, the incidence of infection, particularly surgical site infection, has remained the same. There is a reason why that is, and I will cover that topic when we talk about prevention. But think about the sources of microbes. They come from the patient's own flora, or they come from exogenous sources. What is fascinating and will continue to dictate what happens in medicine, particularly in management of infection and cancer, is the science of microbiome. The Human Microbiome Project is now on phase 2 at the NIH, and next to human genome sequencing, it's the biggest undertaking of modern society. And we have had some fascinating findings, which again, I will share with you. So these microbes and us, we live in symbiotic relationship. These microbes, in fact, are extremely important for our health. However, when that balance between the microbes, the equilibrium gets disturbed, a disease will arise. I'm not sure many of you have seen this article. If you haven't, I strongly urge you to take a look at this. It comes from Canada. It was just published in JBJS. Their notion is that periprosthetic joint infection arises from patients' own flora that comes from oral cavity, nose, skin, or even the GI tract. What they're saying is that the epithelial barrier in the GI tract is critical for health. That's true. You know the incidence of infection is so much higher in patients with underlying inflammatory bowel disease. And we've been blaming the medications, the steroids or disease-modifying agents that they are on. Maybe. But there is also an alternative theory in that these people don't have a barrier, and the translocation of bacteria from the GI tract to the blood causes their infection. That would explain why the incidence of infection is so much higher in patients who've developed C. acne. That particular article cites many of the work that my PhD student and I have done, and we have published on these for the past 7 or 8 years. I would like you to open your mind and think about infection in a different way. Infection could potentially arise from patients' own flora. And the GI barrier is extremely critical. In this particular study, we found that the level of inflammatory markers that determine the epithelial barrier in the GI tract was so much elevated in patients with PJI, zonulin CD14. Work on Matthias Bostrom on the animals, they showed if you change the microbiome of the GI tract, it led to an infection, periprosthetic joint infection in mice. We've written about this extensively, and the gut dysbiosis plays a role. So GI barrier is very important. These organisms from the lumen cross into blood, travel around the body, go to the joint, go to the site of surgery, and cause an infection. But you might say, how's that possible? Don't these organisms get eliminated by macrophages and neutrophils by our immune system? Exactly the opposite. These organisms hide inside those macrophages and neutrophils, and they use them as a vector to travel to the site of surgery. Then they disembark and cause an infection. Trojan horse theory, Japanese scientists discovered this about 15 years ago. We will see them win a Nobel Prize in the near future. Fascinating theory and incredibly important in terms of mediating our immune system plus infection. Nature review article, fascinating, talks about how the GI tract is affected. The epithelial barrier is lost. Macrophages are transferring these microbes to various sites in the body. Every time I pick up a Nature paper, there's a picture of a joint, a prosthesis. They're related to orthopedics. That particular article, in fact, discloses the molecular mechanism by which Trojan horse theory works. So what does this mean? It means the immune status of the host is determined by their microbiome. Your microbiome is determined by your genes. However, you can cheat the genetics by environmental factors, in particular, diet. Very important. As Mehmet Oz, I can't believe I'm quoting him, but he says, your genetic load, your genes load the gun, and your lifestyle pulls the trigger. That's what happens. The twin studies in Stanford, fascinating finding. It's a documentary I recommend all of you to read, how altering the diet changes the immune status of the normal human being, particularly your patients. Why look further? Look at the incidence of obesity in the United States, especially in children, versus the incidence of obesity in Japan. The diet we feed our children determines their immunity, determines their genetic predisposition and predilection for diseases. You, as a normal, healthy human being, should be taking care of your diet. You should be on vitamin D supplements, exercise 20 minutes, avoid smoking, eating microbiome-rich, probiotic-rich diet. And you should be eating 10 different colors of food per day. All of this, and M&Ms don't count. And these are some of the ones that will affect it. Vitamin D plays a critical role in modulating your immune system. Now, if that wasn't enough, there are now incredible studies showing that the musculoskeletal diseases, osteoarthritis, degenerative disc disease, rotator cuff tear, and the whole list is as a result of a dysbiotic state. Your microbiome is abnormal, you develop those diseases. And there is for sure a signal showing that osteoarthritis could be a dysbiotic state. Again, pick up some of these Nature articles and they will try to unravel the mechanism by which this happens. And it's not just osteoarthritis. Chronic conditions like recurrent cystitis, Alzheimer's is thought to be a state of dysbiosis. Diet determines who gets Alzheimer's, who doesn't. And in fact, the current clinical trial ongoing at Harvard aims to alter the biodiversity in the GI tract in order to change the cognitive behavior of the patients. Look back to 1980s when papers being published on spondyloarthropathies, in particular rheumatoid arthritis. There are signals even back in 1980s when you were able to isolate organisms from the synovial fluid of patients with inflammatory arthropathy. We thought those were contaminants. They may not have been. They may have been real organisms modulating and mediating the underlying inflammatory condition. So does that mean we could potentially change the way these patients get infection? The answer is yes. Nature paper, Michael Otto, NIH, administers lactobacillus to volunteers in Thailand and is able to eliminate Staph aureus from the GI tract of all these volunteers. A follow-up randomized prospective study published in Nature showing that administration of probiotics changed the immune status of those patients. Another study published in Nature, time doesn't allow me to go into this detail, beautiful article that talks about osteoarthritis and how osteoarthritis could potentially be a state of dysbiosis. What is interesting about this particular study, when they looked to see at the mechanism in animals, they were able to prevent the progression of the disease by administration of probiotics. Right there at the bottom, lactobacilli. Obesity is thought to be a dysbiotic state. There is a disproportionate number of firmicutes in the GI tract of these individuals, which then predisposes them to other inflammatory conditions such as diabetes, hyperglycemia, hypertension, and other states. And if you treat their underlying dysbiosis, you eliminate the arthritic symptoms in these patients, even without changing their BMI. So again, there is definite underlying dysbiosis. We're in the middle of a randomized prospective study. We're giving our patients 4 weeks of proprietary probiotic versus placebo. We do fecal samples prior to administration of these and then follow these patients to see what happens. The initial signal looks fascinating. I think we will be seeing some very, very interesting and different directions in the future. So maybe the days of metal and plastic is numbered. Maybe there will come a day we're treating these patients by biological manipulation. And don't be so skeptical, because that has happened in medicine. Remember the day when Barry Marshall and Robin Warren discovered that Helicobacter pylori was the underlying cause of this gastritis and peptic ulcer disease. Their work was rejected from every journal. They were thrown out of the Gastroenterology Society, only to receive the Nobel Prize 21 years later. So let me tell you a few other things that will be happening in the 1 minute that I'm left with. Infection is caused by multiple organisms, not a single organism, multiple organisms. One of them is orchestrating the whole deal. The others are there to take an advantage when the time comes. Under antibiotic pressure, you treat a Staph aureus, E. coli emerges. And that's why when you're sending samples for next generation sequencing metagenomics, there is presence of DNA of multiple organisms. And we've had this bad habit of calling these contaminants. They may not be. Listen to this TED Talk by Bonnie Bassler, a microbiologist from Princeton. Fascinating. She's the one that actually coined the term quorum sensing and has done a huge amount of work on biofilm. Her current thinking is that biofilm is a very, very sophisticated society of microbes. Not just one microbe, microbes. They can hide inside canaliculi. Fascinatingly, they can also shut down into what is called a VBNC state, viable but not culturable. They are not proliferating, so you can't pick them up by culture. But if the time comes, they can certainly reactivate and become pathogens. And if you ignore the signal of DNA of some of these organisms, they can come back and cause infection. Finally, a couple of developments. One-stage exchange will become more popular. Everything I'm doing now in Istanbul is all one-stage exchanges. The results from Tom Ferenc's study looks fascinating. We're going to be moving towards local delivery of antimicrobials, not intravenous, not 6 weeks, but local treatments. The 6 weeks in itself needs to be examined. We'll be delivering local forms such as intraosseous forms of microbe. Antibiotics, in fact, are very harmful to our hosts, and in the future we will be supplementing these with probiotics and other means. Giving intravenous antibiotic may not be necessary. It's possible you could treat them with oral antibiotics. Different design of antimicrobials are coming into market that will target those cells, including neutrophils and macrophages, that are transporting these microbes around in order to prevent them. And then finally, phages. How many of you in this room have heard of phage therapy? Yeah, some people. So phage is an old technology, and basically it's when these viruses can attach themselves to the surface of a bacterium, inject their DNA inside, reassemble inside the microbe, produce enzymes called lysins, and then destroy the bacterium. Fascinating technology. We're in the middle of a randomized prospective study, and it shows very, very good promise, especially for multi-resistant organism. Finally, nanotechnology is here to alter the surface of microbes and make them resistant to organisms. Or we will most likely be coating the implants with things like povidone, iodine, like Professor Suchia has been doing. Thank you very much for your time, and thank you for inviting me here.